Hi, this is Dr. Greg Doerr from Bergen Chiropractic and Sports Rehabilitation Center. And today we are lucky enough to have a patient, a friend, and an extremely exceptional psychologist, Chris Henrici, with us today. So we're going to be discussing a topic that I think is paramount, especially within healthcare. I definitely want to get into the athletic component of it as well. So why don't we start off actually with that realm? Because I think it is one of the more interesting ones. We take care of a decent number of athletic populations. I know you are well involved in the sports psychology component. Mm-hmm. And one of the interesting things that I see happen all the time is people that come off an injury, and again, usually catastrophic injury. We're not talking an ankle sprain. We're talking more either ACLs, significant meniscal tears, something along the lines, shoulder dislocation, something that's really paramount where it truly is the difference between I can play, I can't play. Frequently we see those patients really struggle with getting back into sport. As much as they have that drive to be participating again, it's still the fear of, I don't want to do it again. So I want to start with the apprehension, the fear of getting back into play associated with catastrophic injuries with our athletic population. So what is it that you see? How do you present with those, with your patients? How do you get them past that? What's your barriers that you have to cross?
Yeah, I mean, I think that's a great place to start. Before we get to the barriers about getting back into it, I think we have to get into how you present into an office such as this. I'm very big on trusting your medical team. You have to trust your medical team. They're going to give you a sense of community. They're going to help you with goal setting. Goal setting is going to direct how you talk to yourself and other interventions. And so when I work with an athlete and they undergo some sort of catastrophic injury like you're referencing, the first thing I want to do is understand who their medical team is, less so probably the surgeon and more the chiropractic medicine, the physical therapist involved, because there's trust. You reference, I'm a patient here, mm-hmm. right? And I told you I might bring up our relationship.
Absolutely.
Because I do think that in my field we call it use of self. I think that there's a model towards healing, right? And I had seen tons of doctors before I met both of you, and I walked in here, and we joked about this before we sat down, but I walked in here and I had a totally different experience. That lays the groundwork towards dealing with significant injury. Now I'm more in the chronic realm of things, but I still think that matters, because if you leave the provider's office and you don't feel like you understand your care, then I don't understand how you push through barriers, because you're in a silo, right? Psychologically, you're alone. And we know that rehab adherence and I guess recovery outcomes are vastly improved by community, right?
Yeah, absolutely.
Right?
Yeah.
So, I'm curious what you guys see in terms of psychological barriers, but you have to lay that framework, because then you can start to focus on your goal setting. And I'll probably reference goal setting 10 times while we talk here today, but you have to be able to celebrate. Let's talk catastrophic injury, right? So 15-degree improvement in range of motion, I mean, that could be a massive win. But if someone like yourself doesn't celebrate that with the patient, then they don't understand that they really took a huge step forward. So we come back to that relationship, right?
It's interesting that you're bringing up and going back to the people who have the hands-on aspect of it. And there's something that is definitely within our profession, within physical therapy, of almost creating the barrier for the patient. Meaning almost going with what you're saying is celebrating their victories. Rather than, you'll see a lot of other ones will go, oh, you should have been able to do this by now.
That's exactly right. Yeah.
And that creates a barrier already for the patient, the athlete progressing through their program, of saying, what am I doing wrong? Am I broken? Is this permanent? Am I not going to get better? And there's a way to even combat that, because we can honestly say, I would have liked to have been further along than we are right now. But leaving it there or going into, what are we going to do to actually improve that? What are we going to change in order to get past this barrier that we have currently physically? And there's separate ways of doing that where you're actually creating a new pathway rather than creating a wall and saying, figure your way out over it.
Well, that's a rigid prescription of recovery. Everyone's different, right? Correct me if I'm wrong. I'm sure you've seen people's recovery start maybe on the slower side and then hockey stick.
Absolutely. Yeah.
Okay, so then we're not talking about patient-centered care, right? And this is the community that needs to be built, because you also understand pain tolerances and people's understanding of things. So like, there's something called paradoxical intention. It came from Dr. Viktor Frankl. If you haven't read his book, Man's Search for Meaning, it's transformational. But paradoxical intention is basically bring it on, lean into the pain, right? But that's going to be wildly ineffective if you're leaning into structural deficits, right? Or maybe maladaptive patterns of moving, right? But let's take me again. When I came in here and I was here on a Monday, I came back Tuesday, I was bruised as all hell. You both stopped me and you said, hey, do you want to continue with this? And I looked at you, and I remember, and this is the growth of that relationship. I looked at you and I said, is this going to help me heal? And you kind of reluctantly, you were like, unfortunately. But then we built that trust, right? So I could say to you, I'm afraid to do a barbell front squat. And you can both look back at me and say, well, I think structurally, we're not seeing any problems here. Okay, so when you talk about your athletes returning, again, like ACLs are going to come up, UCLs are going to come up. You know, there are certain milestones that they're going to reach. They're going to be terrifying. So in my office, we're going to say, well, yeah, it's okay to be scared, right? But then if I can talk to you and say, hey, look, what are you seeing? Are they ready for this next step? There's a certain amount of trust in your community you have to access. Don't you think?
No, I agree with you. And I want to just say one thing, and then I'm going to actually pass this to Dr. Doyle, because she actually takes care of probably more of our high school population now than actually I do. But one of the things that you were just saying about that kind of aspect is of the fear of the pain is, I mean, one thing that I say, and I say this in classes all the time, is I'm not afraid of your pain. And you shouldn't be either. Is it adaptive pain or is it progressive pain?
Bingo.
Because if you're an athlete, you're going to go through pain. There's no athlete I know of that's never experienced pain in the process of training, play, whatever it might be. Adaptive pain cycles are, oh, it was a 6 out of 10. Now it's a 4 out of 10. Now it's a 2 out of 10. Now I don't even get sore afterwards. That's adaptive pain. That's called getting stronger and healing. Progressive pain is, well, it's like a little ache. Oh, now it's like a 2 out of 10. Sure. Now it's a 4. Now it's a 6. Now I'm getting sore, instead of for 12 hours, it's like 4 days. That's an injury cycle.
Yeah.
And our philosophy has always been, we don't take you out of play. We modify your play so that you can actually heal. The only time we're going to take you out is if we feel like you're crippling yourself and preventing you from actually getting through a season. Yeah. So I'm going to actually pass this to Dr. Doyle for a second, because as I said, she tends to take a lot more of our high school athletes than I actually, I would probably say she even takes more of our athletes, period, than even I see at this point. But what is the barriers? Because we've seen a decent number of pretty traumatic and post-surgical cases, especially in the last couple of months. What is it that you're seeing? Where are the barriers that you see, whether it's the athlete is developing for themselves, or they may be hearing from their coaches or parents or their peers? Like, where do you see the challenges from those athletes psychologically in getting back into the activity?
So especially for athletes, there's always this rush to get back to care. So they'll almost ignore certain things that might be pain, and they'll just say, oh, it's just soreness, just to get back to play as much as possible. And of course they have stress from their coaches and their parents, aren't you better yet? And I think, just like what Chris said, it's really important to celebrate each step along the way, to make sure that they are seeing progress and knowing that they're on a positive trend. I think the more difficult part is when you deal with non-athletes. Like I had someone today who is now going to physical therapy, rehabbing some knee pain. And she's like, sometimes after physical therapy, I feel worse. And I'm like, well, is it that you feel worse, or is that you feel sore? Because, you don't typically do those exercises. And she's like, I don't really know what soreness feels like because I don't exercise. And I was like, it's probably soreness. She's like, yeah, it only lasts a few hours and it goes away. So I think it's differentiating what the patient is feeling and really breaking down, if something's setting them back or forward.
Yeah. I think if I could speak to that,
go.
I mean, that would be one. I mean, I think that's not that you need my compliment here. Obviously, you're skilled in this, but that's really great interview skills because, I work with a lot of high school athletes. They are only halfway through puberty. They have a developing mind. They're not working with a fully developed brain. Mm-hmm. So by definition, they're not entirely reliable reporters, right? That is to say, if I were to say it more plainly, they've maybe never have been hurt before. So there's
the life experience isn't there.
It's just not there. And that's not to criticize anyone, but that's where I think just kind of challenging that pain, like, being kind of curious about it and helping them get into their bodies, right? They're not accustomed to being mindful of their experience, right? The three of us know the difference, for the most part, probably with 95% accuracy, injury versus soreness. Mm-hmm. This is all new to them. So helping them explore, I'll sit with them, and this is where someone with some psychological training can come into play. I'll say, let's get into your body. Let's see about how does your left leg feel compared to your right leg? If I asked you right now to jump, we're not there in a rehab, I understand that, but would you feel fear, right? All of their answers are diagnostic. Mm-hmm. We learn from it no matter what.
Yeah, no, we're talking so much about like the barriers as well of getting in. So I'm going to bring this back again. Let's take an ACL case just because it's easy.
Yeah.
We have the contact sport of, say, football or hockey. You have the non-contact but contact sport of soccer, but a lot more shark cutting. Mm-hmm. It doesn't matter who you are on the field, barring a goalie, going to be shark cutting, period. How do you help to transition them back into trust your body on the field?
Yeah. So once we've done the goal setting, right, I do want them to focus on how they talk to themselves, right? I will have them, if I have a client working with you guys, I'll have them try to hear your voice, right? It's kind of like that. It goes back to trusting your community. Okay, so we've covered that. When it comes to injury recovery, I'm really, really big on visualization and imagery exercises, right? This is nuanced, and you should really do this with someone like myself because there can be pitfalls to it. But if we ignore those for a moment, I mean, with the ACL recovery, we've got a lot of research. If you image yourself performing either a rehab exercise or even image yourself running or performing a sport-specific movement, we see increased blood flow to the injury, which promotes healing, right? Yeah. Furthermore, it's positive imagery that it increases drive towards recovery because they can experience what they love. It basically works off the science of the brain struggles to distinguish the real from the imagined. Right? Maybe you've done the raisin exercise or the lemon exercise where you can taste something sour in your mouth. The brain can induce this stuff. And so we can use that, right? I use it I work with MMA fighters where their body can only take so much punishment. I work with baseball players where the UCL has a pitch count. We use these things to enhance performance, but we can also use it to enhance recovery. And once they get there, I see a pretty significant increase in their confidence.
Yeah, it's... You taking that from the psychological standpoint, I know what we take also is when we're getting to those end stage rehab, it's actually trying to design an exercise that mimics their sport. And if they can actually, holy cow, I just did that, well, yeah, that's what you're going to do on the field. From a sideline perspective, one thing that I have a ridiculous amount of experience in, we don't let somebody back on the field unless we can do their sideline. They have to do their drills on the sideline that they would do in a game before we'll let them back out on the field. It's the same aspect with rehab. Yeah. The end stage of that, like, can you do this in my rehab facility? Then you can do it out on the field. Whether it's plyometric, whether it's a sport-specific motion under load, whether it's a velocity-oriented thing, which we can't always mimic velocity. Like, how do you mimic throwing 100 miles per hour? Well, you can, but you can load up an arm a lot in the same motion, and because resistance levels, the velocity has to decrease to create the same forces. So
what you're saying is they're basically both different forms of progressions to establish a sense of safety.
Yeah.
Or at least calculated risk.
Exactly, because there's nothing that can guarantee they will not get hurt again. There's no guarantee in that. And I know, I'm actually going to pass the mic to Dr. Doyle again, but a common statement that we'll get from patients is, well, can this happen again? You know, I almost feel like I'm going back to Tommy Boy with the guarantee line that he goes through, which, sorry if people haven't seen that movie, but I won't repeat the line because there's some vulgarity in it.
Yeah.
But at the same point, there is no guarantees. How do you handle that patience of going, I'm broken, I'm injured, I'm going to always have that, my warranty has expired, in their brain of going through and like, I'm going to play again, but at the same time, I've been damaged. How do you handle that situation with your patients?
Well, I mean, I can speak to experience. I've torn my ACL before, so I had that fear going back into play that I was going to re-tear it. And you see it all the time, people re-tearing their ACL. I've had a lot of friends that have done the same thing, just because they either rehabbed poorly or they tore their other ACL, or many factors. But it really came down to trusting myself and realizing the more I played, I wasn't injuring myself more. And I had to trust my rehab providers as well, that they can get me back into play and feel strong so that I could feel almost equal side to side and get back into play. But it was really about trust. Yeah, and developing that trust.
I think, years ago I worked with a young man, 17, offensive lineman, illegally chop blocked. The opponent got ejected, right? ACL, MCL, lost his season, devastated. He has surgery, very reputable surgeon. The surgeon told him post-op, you will need a knee replacement someday. I was unhappy. Because, right, these kinds of forecasting, we don't know what kind of technology is going to be around when that young man turns 60. First of all, the surgeon will be dead. And second, these kind of predictive fear, we just don't have a crystal ball. You can't say these kinds of things. And, if you guys see a lot of adult athletes too, but if you're working with a student athlete, they're pretty much by definition still in puberty. You can't give them that doubt. It's irresponsible. I think it's medical malpractice in some capacity. But that comes back to, do you trust your provider? Mm-hmm. I said to him, I said everything basically I just said here, and he kind of breathed a sigh of relief. He's like, okay, all right, and then we can get back to the task at hand, not how he's going to feel in 40 years, right?
Yeah.
I mean, I would defer to you even on that.
I can say, and I'll actually go almost into a negative way for a second, and it'll sound interesting, but then I'm going to have you piggyback into this, because I got a feeling you'll understand exactly the reason I did this. Because we also have the reverse situation, where I have a Gregism, as I like to call them. You lose 100 IQ points a minute you step on the field of play.
Yeah.
Meaning if you're a competitive athlete, you're an idiot.
Uh-huh.
You will play through anything. You will ignore the pain signs. You will ignore everything. So one of the areas, and Dr. Doyle knows this as well as anybody that's ever been in our office, I do not joke around with something like shin splints. Mm-hmm. Because unfortunately I've seen cases where they're with you the rest of your life. God forbid you got a stress. And how many times have we seen people with multiple stress fracture situations associated with that same injury? Oh, I had stress fractures when I was a freshman. I got them again when I was a junior, because I still had shin splints when I was a sophomore. And by the time I hit my freshman year in college and I was still running, then I had them for the third time, and now I don't run at all. So I don't joke around with something, especially with the younger population, where I'm saying, I mentioned it before, if I think you're going to cripple yourself, I'm going to step in. I'm not going to allow you to be. And I just did this with a patient literally yesterday. Shin splints, 3 years in a row.
Yeah.
She happens to participate in a couple of track events that are really notorious for him. And I literally had to sit down, and the mom's there and the kid's there, and I said, look, I'm going to give you enough rope to hang yourself with. But the second I think you're hanging yourself, you don't have rope anymore, and I'm taking control over everything. And I said, but here are the things that I want you to be concerned about. And I gave them the warning signs. Are you sitting at a chair at rest in the middle of the school day and your shins are just aching? That's not a good sign, man. That's not a good sign. That's a danger zone where you've been at rest. It's not the morning after. It's not right after my practice. It's not right after a meet. You're sitting in school. You haven't done anything. You're sitting in your class and your shins are just aching. Well, that is telling me time to intervene and unfortunately give a little the doom and gloom. Because sometimes the guy that's going to lose, the athlete that's going to lose the 100 IQ points on the field of play, You need to almost overstep that boundary and tell them you are going to hurt yourself.
Right. But that's so different, isn't it? Because that is in the here and now, and that is predictive, right? I think I spent a lot of my 20s re-injuring myself being stubborn in that way. One of the great things that I learned was how not to exceed that pain threshold, right? And so, but that has to be said, because if you're going to work with elite athletes, they're only going to know pushing their limits. And that can be really rewarding, but we build credibility in terms of the advice. And I think for me, what I teach my clients is like, you need to be able to do an appropriate body scan. You need to be in touch with what's happening. This goes back to sore versus injured. We need to be able to find even words to communicate that, because with younger populations, that's the other thing we see, their language acquisition isn't super high yet. So they'll just say, it effing hurts. It's just, it effing hurts. Thanks, kid. But that's what we have to work with, right? So of course you have to do that. That has nothing to do with 60 years from now.
No, absolutely not. I don't like the crystal ball. I gave an example of something that I just did. When you know you have that injury in front of you, you're going like, even in the back of your head going like, feeling a little uncomfortable with this. Not from the standpoint of taking care of it, but that athlete who is the 100 IQ points are gone the second they step on. What is your perspective? How do you go through the psychology with an athlete? I just gave an example myself. What would you do?
So I have to really explain to them that you might feel pain as you're, let's say, running or doing whatever activity that you're doing, but you have to make sure your pain isn't increasing as you're running, especially if the adrenaline's going, and most people don't really feel the pain. And especially in that moment, if you are feeling the pain increasing, you're making yourself worse. So I think that when you tell them you are making yourself worse, and you'll be out of play longer if you continue, that really sits in, rather than, when you have pain, just stop. Because I think if you tell them this is going to keep you out of your sport longer, then they'll back off a little bit and take care of themselves.
Can I ask you a question about that? Do you ever prescribe like minutes restrictions? So like soccer return to play, you can play 10 minutes each half kind of thing. Do you have a philosophy on that?
So sometimes, yes. I think when it comes to shin splints, we usually go on laps. So I think we'll start to your tolerance at 1 lap, and you have to really build it up. So it might be you're only running 1 lap for a week, and then see how you feel. As long as you're not regressing with the 1 lap, then you add on to there. So it might be a very, very slow, especially for a distance runner, and frustrating because they're used to running for 4 miles. So they're not only feeling defeated, but they feel like they can do more when maybe they may not be able to. So their body has to build up a tolerance, not so much their mind.
That's another one of the return to play with injuries and going into this. And I think this is another one that I'm going to just throw right on you. Like Dr. Doyle just set another wave that we have to surf it all the way in. When you have that coming back to play aspect, and let's take it forget about the fear avoidance. People keep trying to push too hard.
Yep.
So now it's the pull back the reins thing. The shin splints is a great example because I have had a number of cases where through a lot of effort have created a form of a running rehab program. But as Dr. Doyle just said, it is so painfully slow. But the problem is the people that have actually completed it end up not having shin splints ever again. How do you get people to slow themselves down who are the go, the A+ personalities that are all success, goal-driven, and we've basically pulled back the reins to something where they feel that I'm now a baby crawling again?
God, I could answer that in so many ways. So I think so we talk about goal setting, right? We have long-term, mid-term, short-term. I think if you can paint the picture for them, if they see the roadmap, or at least a trajectory of the roadmap, they almost need to, I give you permission to stop. Right? So much of what these elite athletes internalize, some of it's intrinsic motivation, but some of it's coaches, really well-meaning great coaches, pushing them to the limit, which makes them better, but it's not better if they can't play. And so I do like them to see what's going on in terms of hitting their milestones, because then what we can do is we can talk about, and this was talked to me by Dr. Charlie Marr with the Cleveland Guardians organization. I think it's so paramount to being elite at anything is being an accurate self-evaluator, right? and a good separator. So one, am I pushing too hard? You have to be able to answer that question. And we need to be able to hold them accountable to that. If you really want to be great, then you cannot exceed these prescriptions. You can't. And if they push beyond that, it's like, well, I don't know why you're doing this to yourself. You have a team here, and we're working with you. But then a lot of them will say, like, well, then I don't know what else to do. Right? This is where I encourage hobbies, especially with athletes. I mean, and injured athletes, read a book. That sounds laughable to some people, but they don't have time for that. Right? I work with a high school swimmer. She is occupied from 6 a.m. until 7:30 p.m. There are no hobbies. There's no life outside of school and sport. That increases pressure and increases drive because now their identity is tied to this thing, right? The best athletes I've ever met, they don't fear failure because it doesn't mean that they're a failure, right? I've given presentations, I've fallen flat on my face. That doesn't mean I'm bad at what I do. It means I gave a bad presentation. So when it comes to injury recovery, right, how do we help them cope? No, I give you permission. This is controversial because you want to be careful about it, but I'm not really anti-video games. If you're driven, you fully exercise, you're getting good grades, and all these boxes are checked, sure, an hour and a half, go ahead. Because what they're not doing is exacerbating their injury. What do you think of that?
That's a great one that you actually brought up, is because I say this, especially with my oldest son. It's actually a really simple one. Now, he is not the type of driven athlete that I was. He's not even close to it. He participates, but I guarantee he'd rather do 3,000 other things other than be on the soccer field. As I jokingly say with him, it's like, I like to coach, so you should play. But the reality is with him is I tell him all the time, I have absolutely no problem with you playing video games so long as it doesn't become the dominant part of your life.
Yeah. It's got to be a hobby.
It's got to be
activity.
Part of your recreational.
Yeah.
I want you to learn to be active. I want you to learn the socialization of being on a team. I want you to learn to win. I want you to learn to lose. Mm-hmm. I want you to learn that you have to work harder to be better. All of those things are so valuable in sports.
Yeah.
And I think that's what maybe our new generations are missing. Like, we were all told, go play. Like, we didn't. I don't ever remember going to my parents and saying, yes, sign me up for Little League. I didn't like baseball. No. But I was signed up every year no matter what.
I think my dad forged my birth certificate, yeah.
But, I mean, all of those things, like, I mean, did you ever get, like, when you were really young, I mean, elementary school levels, did your parents ever go to you and say, like, hey, would you like to do this? Or was it just recreation and said, like, hey, by the way, the next sport it's soccer, now it's basketball, now it's blah, and you just go through it?
Yeah. I mean, I played basketball my whole life. That was my main sport. And then I just got to a point where I hated it. And I told my mom, I said, I'm quitting. She goes, okay, what's the next sport you're picking up? And I was like, I don't want to pick up it. She's like, you're playing another sport. And I was like, okay. So
there's actually a term for that. Angela Duckworth out of the University of Pennsylvania. It's called, like, grit. There's a psychological definition of grit. And what's your next hard thing?
Yeah.
What's your next hard thing, right?
She's like, you're not sitting at home doing nothing. You're picking up another sport. Like,
but through the lens of injury, right? Like, I'd be curious, when you tore your ACL, how did you fill your time? Because it can't be pushing the limits in that recovery. We need to find other things to occupy us. And most of my athletes, I don't know about you guys, what they know is activity. That's just not always feasible.
Yeah. So my main problem was I tore it. My lacrosse was my entire life. I tore it in college. So the only thing I was doing in college was class and lacrosse. So whenever I had free time, which was sitting at practice watching everyone else practice,
it's another subject,
it was like another level of misery.
Yeah.
So it was just anger. I was upset, was depressed. And then my coach kind of had to shake me and be like, you have to get involved. You have to coach. You have to, shoot on the goalies. You have to do everything possible to get this team better, not just sit in the stands and be miserable. So I think she was the one that really forced me.
Did that help?
It did, yeah. I was in charge of warming up the goalies, and the goalies actually liked how I did it versus others.
It is difficult to stand on the sideline and just watch your team practice. I think coaches have good intentions. I think a lot of athletes end up just feeling left out. And some of them will say to me, I could be rehabbing. Why am I here watching to go home and rehab kind of thing? And this is where I do think hobbies, and that, by the way, we said books, it could be connecting with family, it could be food, It could be improving your grades. There's a variety of things. But when they can fill their lives up with other things while they're under a minutes restriction, so to speak, I think it improves their outcomes.
Yeah, and I would say from that standpoint, we don't tend to go, or at least from my standpoint, I don't tend to go specific minutes restriction. Definitely distance does come into play. We've done that a lot of times. But it still comes down to what you've said a number of times, is knowing your body.
Yeah.
What is it that you feel? How do you progress through this? Is it adaptive or is it progressive? And that is determining where our next phase is. All right. Now, unfortunately, all I can say is I now have about 5 other topics that I actually want to discuss with you. But the good news is we still have another podcast together. So hopefully we'll hit some of those. So on behalf of all 3 of us, once again, I appreciate your time listening to us. And with any luck, this was some information that helped you along in any injuries that you may have had or brought up some questions that you may want to present to our office.